You know what? If you're sitting there dealing with chronic pain, and I mean that relentless back pain that it follows you everywhere, you've probably heard whispers about non-surgical spinal decompression. And let me tell you, there's so much a misinformation floating around that people are making decisions based on half-truths and wishful thinking. So here's what I know after years of seeing this firsthand. This isn't some magic bullet that'll cure every ache and pain you've got. I wish it were that simple. And what it actually does is target nerve compression from herniated discs, spinal stenosis, that kind of thing. If you're dealing with muscle strain or inflammation without nerve involvement, well, you're barking up the wrong tree. Now, some people think these decompression tables work exactly like surgery, and that's just no. These machines create traction. They might temporarily give your discs a little breathing room, but they can't physically remove bone spurs or disc fragments. Some folks get temporary relief, sure, but we're not seeing the same structural changes you get from actual surgery. But here's the thing, and this is crucial, surgery shouldn't be your first thought either. We follow this conservative approach now, right? Chiropractic, physio, meds, maybe some, even injections. Surgery comes way later after we've tried everything else. Unless you're dealing with something really serious neurologically. And people think spinal surgery is this terrifying thing. Look, yes, there are risks. There always are. But listen to me carefully. Even if you do get decompression therapy with us, you're not going to wake up tomorrow feeling like you're 20 again. Recovery takes time. Some people feel better right away with certain symptoms. But full healing, that's weeks, maybe months. So you need to know that going in. And here's what really gets me. People think anyone with back pain qualifies for this. That's not how it works. We need specific findings on your imaging that match what you're feeling. And you also need realistic expectations. Even if it works beautifully, that doesn't make you invincible. New problems can develop as you age, as your spine changes over time. So I also must emphatically say this, success rates can be incredibly high with this treatment. But here's the kicker, that success really comes down to two critical factors. First, we have to make sure the patient is actually a good candidate for this type of therapy. Not everyone is, and that's okay. It's not for everyone. And second, and this is huge, the practitioner's skill level and their deep understanding of how the spine actually works makes all the difference in the world. Bottom line, spinal decompression can work wonders for the right person with the right condition, but you've got to cut through all the noise and make decisions based on facts, not hope.